Hey everybody, this is Dr. Clark Shirla, Director of Aesthetic Surgery for Northwestern Specialists in Plastic Surgery, here with some important information about recent news about breast implants that you may have heard that may be of some concern. Here at NSPS, our number one priority is always patient care and patient education, and so we felt it was really important to get some information out there, quality information about what's going on to try to help you decipher some of what you may be reading about or hearing about if you're concerned about these topics. These include breast implant illness, breast implant associated anaplastic large cell lymphoma, issues around informed consent, issues around the Allergan recall, and other general issues around texturing and breast implants. And so I'd like to kind of touch on some of the evidence and information and state of affairs of each of these important and very timely topics. Firstly, the issue of breast implant associated large cell lymphoma, BIA-ALCL. This is a topic that we here at NSPS were actually the first plastic surgery practice in Chicago to have a dedicated website presenting information to patients on. That was several years ago. I want to say back in 2011, I believe. It was either my first or second year in practice here with the group. But it's something that is a evolving and emerging topic. We're gaining more information. Some of our friends and colleagues around the world have been doing really groundbreaking work on trying to collect the information about the cases and helping us understand the specific risks involved. As this information has emerged, there has developed some concerns around the role that texturing may play in creating this issue. So the issue is a very, very small minority. This is still an extremely rare entity. And we're talking risks that are anywhere from 1 in several thousand to 1 in several 100,000. But certain women who have breast implants with a fairly aggressive texture develop some irritation as a response to these implants. And if patients do develop any symptoms of swelling or pain associated with a breast implant, we always encourage our patients to seek follow-up and medical attention so that that can be evaluated. But in cases where these kinds of symptoms were not immediately followed up on and potentially ignored for a few years, it does appear that some of these patients are developing a very, very rare form of cancer known as anaplastic large cell lymphoma. Anaplastic large cell lymphoma is a type of a blood-borne cancer that in general carries with it a different prognosis than when it's associated with breast implants. This does appear to be a specific form of ALCL that's associated with breast implants, and so therefore the entire scientific name for this entity is breast implant associated anaplastic large cell lymphoma, BIA-ALCL. And we are still learning more about the specific causes and specific risks, but it does appear that the aggressive texturing on specifically some Allergan breast implants may play a role in developing this disease. For specific information on the most current data on those risks involved, you can visit the link in the comments below on our website, and we'll have that updated information for you as we obtain it from the FDA and from our colleagues that are researching the topic actively. As a result of this, Allergan has voluntarily recalled their implants in the US that contain this texture. Now they make a number of different implants, and we continue to use a number of different styles of Allergan implants that are smooth, the non-textured varieties, both in our breast cancer reconstruction work as well as in our cosmetic surgery practice. And we do still have a lot of faith and confidence in Allergan as a company and Allergan, the Allergan product portfolio at large, but it is important to know that they have currently recalled the texture devices that contain their aggressive BIA-ALCL texturing. The recall does not include a recommendation that these implants be removed. There are risks associated with surgery anytime you have surgery, and so even a minor surgery such as surgery to remove breast implants can have with it associated certain risks. And as such, if your breast implants are textured and if your breast implants are not symptomatic in any way, the official recommendation is still that these implants are probably okay. You should keep an eye on them. You should always be monitoring your breast to make sure that there are no symptoms such as swelling or pain, as we discussed. And if you do develop these symptoms, or if you have any questions or concerns, you can always feel free to contact your plastic surgeon, hopefully your board certified plastic surgeon who helped put the implants in. And like us, they should have the most up-to-date information about your options. As part of the recall, Allergan has provided additional support in terms of willingness to pay for a free pair of breast implants that are smooth if patients are concerned enough that they do desire explantation. It's important to note that this offer does not include financial compensation for surgical fees or anesthesia fees associated with the surgery to remove and replace the implants, but they are voluntarily offering to provide a free pair of implants at no charge to the patient in order to help defray some of the costs if those concerns do include enough of a concern that the patients would like them replaced under this special warranty. And this plan is in effect for a period of 2 years currently, although that's always subject to change potentially in the future. If it is something that seems interesting to you, if you do think that you have Allergan textured implants or any Allergan implants and you're just concerned and want to kind of understand more about what situation you're in and want to make sure that you're completely safe, you always feel free to contact us, contact your plastic surgeon, and make sure that everything's okay, and we'll be happy to help you out with these issues as they continue to evolve. Transitioning to the topic of breast implant illness, or BII. This is a unique and separate entity, and this is something that's been around for as long as the silicone implants were under some scrutiny and actually taken off the market for a period of time back in the 90s. This is a family of diseases that many patients do attribute to their breast implants, which have never been able to be proven in terms of a causal link when studied rigorously through scientific testing that we are able to perform. Because the scientific testing has never demonstrated any strong link between these diseases, the implants were deemed safe, and that was really the impetus for the FDA re-releasing silicone breast implants on the market for use for cosmetic and reconstructive purposes. Despite that, there are many patients who still do feel strongly that they have some issues, whether they're rheumatological issues, autoimmune issues, other issues that seem to be attributed to their implants. And we always respect the wishes and thoughts of our patients in terms of if they have a strong enough feeling that there is a connection. I personally have some patients that have had their implants removed because of these concerns, and they feel like they have gotten better. And we absolutely respect the mind-body connection and the fact that that is something that's important to kind of understand and empower our patients to feel like their feelings are understood and respected despite the lack of medical evidence to support these issues. So that again is something that if you feel like you are having any of these concerns and you'd like more information, we would definitely encourage you to seek a consultation from your board-certified plastic surgeon or here with us at NSPS, and we can provide you more information on these topics as well. The specific topic of texturing, so I mentioned already that the Allergan texturing seems to be the one that's of most concern, and Allergan has voluntarily recalled their texturing from the market at this point. There are different texture devices in the market, and if you'll go to the link on our website, there is some up-to-date statistical information that shows that the textures are categorized differently based on how aggressive they are. It does appear that the Allergan BIA-ALCL is the most aggressive texture and has the highest correlation with the BIA-ALCL risk. As of this filming of this video, that risk is estimated at about 1 in 3,000, I believe. If I'm wrong, we'll post a correction in the corner on the video. Other forms of texturing are less aggressive and therefore less irritating potentially to the body, and do seem associated with a much lower risk, 1 in 30,000 or even 1 in 100,000. And so it's important to understand if you do have a textured device in general, whether it's from another brand like Mentor, Sientra, or other brands, especially if they were put in another country, that these forms of texturing may not be as much of a risk in terms of these specific issues. But again, to be on the safe side, if you have any questions or concerns, you can always feel free to comment, contact us for a consultation, or visit with your board-certified plastic surgeon. Finally, issues around informed consent. It's important to understand that We are always dedicated to the informed decision making of our patients. We work with our patients to help them understand the risks and benefits associated with any surgery that we perform on them, and breast implant surgery is no different. I personally serve on the Informed Consent Task Force for the American Society for Aesthetic Plastic Surgery, which is currently active in developing guidance to the FDA for informed consent language that will be provided with every pair of breast implants that is sold in the US. And this is something that we are dedicated to here at NSPS. I'm dedicated to it personally. And once again, just wanted to reiterate our dedication to patient education and patient safety as our first and foremost priority. Hopefully you found that useful. Any other questions or topics around this that are of any concern, please feel free to leave a comment below. As always, we encourage you to like, comment, subscribe. Make sure you click that bell so that you get notifications as we post new information in this ever-changing landscape. I hope you have a wonderful day. Thank you.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.